Today we're discussing sexual dysfunction, how it affects both men and women, and why it's important to address it as a couple. Joining me in studio to share insights on this important topic is Dr. Mark from the T Clinic. Now Mark, sexual dysfunction is quite a broad system, I guess we can call it that. Tell us about why it's so important that we need to be addressing sexual dysfunction sooner rather than later.
Michael, I think let's start with the definition of what sexual dysfunction actually is. It's anything that prevents an individual or a couple deriving pleasure from sexual activities. And sexual functioning is so important. It cements relationships. It's healthy for us. And when there's a problem, it usually spills over into relationships. It can create severe mental anguish, etc., etc. So it really is something that needs to be addressed, and people do not talk about it.
Absolutely.
It's incredibly common. 40% of women and up to 30% of men will battle with sexual dysfunction. And today still, people are afraid to talk about it openly for many reasons, with fear of judgment, etc., etc.
Yeah. And Mark, are there different types of sexual dysfunction? As I mentioned, it's broad, but are there specific categories?
Yes. Michael, I think you can define it into two big groups, physical and psychological sexual dysfunction. But to make it easier, we actually refer to it as sexual desire and lack of interest disorder. That's one. Okay. Arousal disorder, orgasmic disorder, and then pain disorder. So those are the four big groups. Okay. And each one of them have their own specific characteristics and what caused them, and then different treatment modalities. And that's why it's so important that when you are having problems on a sexual level, that you discuss it with someone that actually delves into it, instead of just giving you a little blue pill and don't understand what was the underlying cause, because there's many.
Absolutely. And Mark, often I think there's an expectation from either the one partner or the other saying, like, this is my fault, it's my issue, I'll just quietly deal with it. This is something that affects both men and women, right? Sexual dysfunction. It's not that it's one or the other.
No. I think one of the most important things that we need to understand is the biggest consequence of sexual dysfunction in one partner is that it leads to sexual dysfunction in the other partner. So, for instance, we can think of a guy that's now battling with erections. That's going to create a sense of embarrassment and anxiety, and we're going to start skirting around the issue. In your partner, that's going to awaken a sense of what's wrong with me, is their infidelity. So it becomes a spiraling effect. And when you don't talk about this openly and confront it, it now has a sense of resentment, a sense of guilt in the relationship, and eventually a complete physical disconnect, which often leads to emotional disconnect.
Absolutely. Now, Mark, in terms of communication, as you mentioned, it starts with one thing. Then there are feelings of inadequacy, expectations that there may be infidelity. So how important is communication between a couple early on at the very first signs of an issue to prevent it becoming a really big problem?
Michael, I think that's the most important thing that you can do in a relationship. If you're going to be physically intimate with someone, you need to trust this person. And experiencing problems, for women, for instance, starting to experience discomfort is a sign of an underlying condition. And then, because it's no longer pleasurable, it becomes an obligation for them, with consequences like infections or pain afterwards. and you know what, you start withdrawing. But reaching out to your partner and saying to them, you know what, I'm starting to experience these symptoms. I think, you know what, we need to acknowledge them and start working around them, and, you know what, maybe even reach out for help so that, you know what, we can have a healthy physical relationship.
Yes. Yeah.
But it's not just physical, it's also emotional.
Absolutely. And I think this is such a fundamental of a relationship. It's an emotional thing. So you need to make sure that you're on top of it. But now, what are some of the early warning signs that there may be a sexual dysfunction of some kind? I suppose we'll dive deeper into the more specific things, but generally, are there some key indicators that you'd want to say, oh, hang on, let's delve in there?
Michael, if the classification, World Health Classification and the DSM classifications would be if you do not derive sexual pleasure out of a sexual encounter for 75% of encounters, so the majority of encounters, you can now be classified as having a sexual dysfunction.
Okay.
And again, it's broad. This is a lack of libido or a lack of interest in sex, or the lack of being physically aroused, where your mind's there, you know, you're horny, but you do not get physically stimulated.
Right.
And then also for men and women, and this is, I think, underrated when it comes to sexual functioning, is the orgasmic disorders. For women, being unable to reach an orgasm, really common, especially in younger women. And then for men, either premature ejaculation or a delayed ejaculation.
Okay.
And then the pain disorders. And this is huge in older women, and sexual abuse also can play a role there, where we have negative connotations and very specific conditions. But as we go through the season, we'll highlight the individual ones that people should know about.
And Dr. Mark, you mentioned how it's important that we don't just offer somebody a blue pill to solve the issue.
No.
How are sexual dysfunctions diagnosed? What would the process be if somebody's experienced something to understand exactly what they are dealing with?
Michael, I think the first thing is speak to your partner and then reach out for help. And, you know, it does not necessarily have to be a medical practitioner. It can be a sex therapist that work with us on a daily basis. It can be an understanding friend that can help guide you. But the most important one, speak to your partner, especially if you're in a relationship. If you are on your own and, you know what, it's a one-night stand kind of thing, now it comes with different questions that you need to ask. But reach out for help, because most of sexual dysfunctions, or most causes of sexual dysfunctions, can be addressed. And sexual dysfunction is the first sign of an underlying, more serious condition. Cardiovascular disease, menopause, andropause, hormonal changes, depression, anxiety.
Right.
So it's not something that should be ignored.
So Mark, in going on to that point of how there are other influencing factors in your health that would affect your sexual function, is it a combination of certain treatments plus lifestyle changes that are going to be the things that get us back on track?
Yeah. Michael, if we take a look at some of the problems, stress, very big, sleep, sedentary lifestyle, diets, habits like smoking, alcohol, recreational drug abuse, all of those can cause sexual dysfunction. Physical things, you know, now we're starting to look at diseases, hypertension, diabetes, kidney, liver problems, vascular problems, metabolic disease. All of those can have an effect. And then we haven't even touched on the psychological stuff.
Yeah, absolutely.
Depression, anxiety, previous abuse, post-traumatic stress syndrome. So it's common, but it's something that we can address effectively. Lifestyle changes always play a role.
Okay.
You know, as in everything. Have a healthy diet, get some exercise, sleep well, and manage stress effectively, which is probably the most difficult one to do.
Okay. And then on top of that, there may be a medical intervention that would then be solving.
Absolutely.
Okay. Mark, we're going to be delving into the specific types of sexual dysfunction in the coming weeks, but in the meantime, remind us again, please, when people want to get in touch with you to find out more or open up a discussion, how do they get hold of you?
So, Michael, the T Clinic is based here in Bryanston, Johannesburg, but we consult with patients all over the country and indeed all over the world. I think the easiest to get hold of us is either via our webpage, www.thetclinic.com, or call us on 010-824-1393.
Wonderful, Mark. Thank you. I look forward to the future discussions that are coming up.
Thank you.